To have to potentially be off of work for 2 weeks with a kid that might have COVID, might not have COVID, maybe you can't get in for a test in a timely manner is really, really stressful.
As parents prepare to send their kids to the classroom, it may not be for long, as common colds and suspected or confirmed COVID-19 cases may keep them at home. Just another stressor to add to the pressures for parents created by the pandemic. And with so much uncertainty, can you be certain you'll have a job to return to?
Any employee really who has children that are not at home with them already is going to be in a situation where they're going to be having to deal with, probably at least on 1 or 2 occasions over the next year, these unpredictable, unplanned absences that could last for an undetermined number of days when they start.
Sarah Coder, a lawyer focusing on employment, labor and law, says under the Alberta Employment Standards Code, employees are allowed up to 16 weeks of unpaid leave in a calendar year due to illness or injury. In March, the code was updated to include quarantine.
The parents can know that they've got up to 4 months of job protected leave while they're dealing with a quarantine for themselves, or if they themselves become ill as a result of their child having COVID.
The Employment Standards Code also provides 5 unpaid days of leave for health issues or for family needs, which Coder believes is where caregivers will run into an issue.
Those 5 days per year goes like that.
Would an employer be willing to give an employee paid sick leave? Is it in addition to their regular sick leave, or is it part of their regular?
Melanie Peacock, a human resources professor at Mount Royal University, says communication is key and expectations need to be set early.
What's really going to be important is for employers to think through not just what this means now, but how they treat and how they interact with their employees has long-term implications.
As for Coder, a mother herself, she says the next few months is going to be a juggling act for working parents.
A lot of the alternative caregivers, like grandparents, that's kind of out of the picture now. You can't rely on grandma and grandpa if your child potentially has COVID. So it just is a really, really tough situation all around.
In Calgary, Jackie Perez, City News.